Yes, hi. My name is Linda Iannone. I'm a visitor to the community. I'm from Sherman, Connecticut. So actually you don't represent me, but I'm glad to meet you. I'm working as an in-person assister for Access Health CT. And I just wanted to address the group as I am a faith leader in the Congregational Church, United Church of Christ. I've been involved to address and look at the healthcare system in our state for the past 5 years. And as a justice issue, we took it on for the United Church of Christ. I brought lots of materials here. I am going around. I have put myself in personal jeopardy and poverty to do this work. I want to tell you the truth, the sisters get very little money, but I brought a huge amount of resources for everybody, and I'd be glad. I have so many positive stories to tell about how the ACA has empowered and helped the middle class, giving many people tax credits. No longer can people be ripped off. And I became very involved in the process of being on the advisory committees and all that around our state exchange that is developed by, unfortunately, mostly insurance companies, which is private. So I just wanted to offer myself as a resource here. I have so many good stories. I don't even, so.
Thank you.
But one minute is my own personal story. I'm a farmer and a horticulturist by training. I never was able to have health insurance or afford it. My husband, when he had a job, would have it. When he lost his job in about '06 and wasn't employed for 2 years, our COBRA was $700. And as soon as that ended, our premiums were $2,000. I have a health concern. I'm a cancer survivor. And I had to go through all our savings. Thankfully, our house was paid for. But many, many, many people that I'm servicing in the Danbury and Fairfield County area have lost their homes because of healthcare costs. So as a faith leader, who is my brother? Who is my sister? What am I supposed to do?
Thank you. Thank you, Mrs. Iannone. I do want to acknowledge a lot of the conversation tonight has been about healthcare, and I'm trying to be as straight as I can with what IPAB is, death panels. I do want to acknowledge, and I'm sorry, ma'am, I forgot your name, but a couple of people very concerned about the healthcare reform have made a very good point, which is one of the chief challenges, and the one thing that could actually make this whole thing not work would be if younger, healthier people choose not to sign up. And ma'am, I think you alluded to the fact that the penalty is actually relatively low for not signing up, and so you don't sign up and you're in the emergency room, we're all paying, and you didn't get much out of it. So that's a very serious concern. And we'll see. The enrollment period, the open enrollment period ends at the end of this month. You have pre-existing conditions.
Exactly.
So if we do have to go back to the drawing board, which could be caused by young people not coming in sufficient numbers, that's going to be a challenging place to be. But I do want to acknowledge that that's a very... I'm sorry?
Could that be solved in 10 pages instead of 2,000?
I don't know, honestly. I don't know.